referrals, no waiting room, no copay. Direct from the NYU Langone Medical Center. This is Doctor Radio.
Welcome back to the show. I'm Dr. Doris Day. I'm Clinical Associate Professor here at NYU Langone, and you can follow me also on social media at Twitter, Instagram, and Facebook. Like, rate, follow, do all that good stuff so I know you're there, and it makes me happy, and I'll try to respond to your comments as well. Well, I'm very excited to introduce my guest, Dr. Tammy Polit. Dr. Polit is the founder and medical director of, how do you pronounce it?
Utopia.
Utopia. Oh, I love that name. Utopia Med in Texas. She's been in practice for over 25 years, although you'd never know it by looking at her. She's right here in studio and is gorgeous. Her practice emphasizes a natural approach and minimally invasive options to help her clients accomplish their personal best and well-being. And I love that because I have centered this show around hope, and that's how I started my segment. So welcome to the show. I'm so happy to have you on. Did I pronounce your last name right?
Thank you for having me. Polit is correct.
Oh, good. Because sometimes there's like a little accent to it. So, well, how do you feel? I'm going to just start out by using a word that I'm ambivalent about, but how do you feel about the word holistic? What does it mean to you, and is it a word you would apply, do you think applies to what you do?
It depends on who's saying it.
It's a good answer. That's a good answer.
Yeah.
So how do you hear it, and how would you use that word? Like, what would it mean to you for your practice and your patients? Because I use it for me, but I agree with you. It depends on who's saying it. I like to think of myself as holistic, but not as rejecting Western concepts. It's just embracing everything that's good and that works across the board, whether it's Eastern, Western, natural, or whatever natural means.
Right. That's the word I prefer to use, which is natural. When people come in and they want to look natural and fresh, refreshed, but not look artificial, we try to lean more towards the natural word versus holistic, because I think that is just a different tone for what we do.
Yeah, I agree. And I've sort of learned to embrace it on some levels, but every time I do that, I try to redefine it so that I put my definition of it out there. And I have the same issue. I had a friend of mine who's a plastic surgeon, who wrote, natural is a myth. Beauty is expensive.
That's right. Right.
And I thought that was very funny. But the idea of natural, too, is kind of interesting. So when you look at that concept of like what somebody means when they mean natural, how do you convey what that means?
Well, in our line of medicine, cosmetic is changing very, very rapidly. There's so much innovation going on right now, and you can use synthetic fillers, but you can use natural products too. You can use your own blood and use the platelet-rich plasma from that. That's a natural alternative. You can use your own fat as a fat transfer instead of a filler. That's a natural alternative, and it's really well received because it's your own body's tissue, and the results are pretty fabulous.
Yep, and that's true. Even the hyaluronic acid that we use is essentially natural because it's exactly what your body makes. So It's identical to what your body has. Right. Talk about confidence. That's the theme of our segment, is really talking about what we do for our patients to help them have more confidence, because ultimately that's how I see beauty, is things that are more ethereal, things that we don't inject or transfer or do to them. It's what we can help them see in themselves and be their best at.
Right.
So how do you, what kind of people find you, not what kind of patient, but what kind of patients come in to see you, and what is the difference from when they come in to when they go and that journey that they go on?
Mm-hmm. Well, in the DFW area, we have a really diverse population, which is very nice. It's challenging in its own effect, but I think the biggest tag with confidence is in that first discussion. It's so important when you interview them and really try to see what their goals are, just trying to figure out which way they want you to head. And I usually ask them, what is it really that bothers you? It's not just the pretty face thing. It's, if they're having some stress at home, it's body, mind, and soul, really. But I tell them, if we get to a point where every single day you get up and you look in the mirror and you say, if I have to look at this one more day, whether it's your belly pooch, whether it's your love handles, whether it's an old scar that didn't heal and is a little off balance from the rest, if it's going to stress you out that much, it's just so important to really try and figure out some way to really help them. And if we can do it in the most non-invasive way that we can, I think that gives them the most satisfaction. And those clients are just, in tears at the end. Oh my gosh, I never thought I'd get rid of this. I've had ladies who say, I was afraid to take off the garment after 8 or 9 weeks because I looked in the mirror and I thought, is it going to come back?
That's funny. Well, if you want to give us a call and share your story about a procedure you had or how what you've done has changed your perspective, we'd love to hear from you and we'd love for you to join the conversation. We're at 877-NYU-DOCS, 877-698-3627. And also give us your social media so our listeners can also find you.
Great.
Give us your social media.
Oh, my social media. It's medbutopia.com.
Okay.
We are also on Facebook, Instagram, and Twitter.
Perfect. And a website as well. And it's all the
Yes.
same handle. Beautiful. I love that consistency. It makes it easier. Some people have like one name for one thing, and it gets confusing to see how to follow them. So medbutopia.com. Perfect. And I like that name, Butopia. How did you come up with that?
It was one of those realizations at 2 a.m. What is it that I really want to accomplish? When you go through some trials and tribulations in medicine and you've done all different things and you really find your direction where you need to be in life, that really came to me as what can I do to help people the most, to make them the happiest? And it really is to give them that confidence.
Well, talk a little bit about your journey because it's a circuitous path. It seems like you went through a few different iterations. So talk a little bit about how you got to where you are and why you do what you do and how you see it.
Sure. So I was in a procedural medicine program, and we were an unopposed residency program, so there were no other residents there. We did everything. So we did all the deliveries, we did all the neonatal resuscitations, we did all of the circumcisions, we did all of the flexible sigmoidoscopies, we did the Swan-Ganz catheter floating in the ICU, all the line placement. It really was an amazing program, and I chose it specifically for that. Not really knowing that I wanted to do surgery, just that I love doing manual things. Mm-hmm. And I did that for a long time, and there are challenges with family medicine. So I continued as I went into private practice to do more and more procedures, office-based, using local anesthesia. I was very comfortable doing that. And then, a lot of sales and advertising come in as far as companies with neurotoxins and fillers, and I thought, well, that might be kind of fun. And when I saw how happy that made people, that really sparked a little flame for me. So I started with that, and then I went and worked, in addition to my medical practice, I went and worked at a spa, and then they wanted someone to do fat removal. Well, I wasn't liking the little over-the-counter injectable treatments that they had at the time. They seemed a little bit, nerve-wracking to use. So I took on my own path of training myself over a 2-year period outside of my medical practice in learning how to do tumescent office-based liposuction, where people don't get put to sleep. You use local anesthesia. The recovery time is amazing. The incisions are called dot incisions because they're about 2 to 3 millimeters. And for appropriate patients who are screened properly, it really changes people's lives. So I did more and more of that, and now I'm actually getting into regenerative medicine because fat now we know has amazing stem cell potential, and regeneration as far as facial rejuvenation versus orthopedic joint, tendon, and ligament repair. And I've had experience with all of that in the past, so now I can really bring back medicine into my aesthetics practice, and that's really been fulfilling for me.
It's incredibly broad. How do people find you for these different things? Because it sounds like they're vastly different. from like the medicine side to the regenerative side and to the purely aesthetic side.
Right.
I mean, it makes for an interesting day, but it's got to be it's hard.
I think there are two major branches, and that's the liposuction versus the regenerative side, and word of mouth is great. We do a lot of advertising.
That's good. I think the regenerative medicine is the future. We're learning more and more about just bioidentical hormone replacement and about just nutrition, all of those things that enhance our own body's ability to restore and enhance itself. So
Exactly.
It's the wave of the future, but it's work. I find that sometimes, though, it needs to be combined with patient involvement and effort. So if you're going to do all this, you need the patient to understand that the diet has to change, that you need to eat mostly a plant-based diet that is going to be heavy in cruciferous greens, ideally less in alcohol, got to keep up with sleep, all of those things. But I think that it motivates people, and that's the confidence side of it, right?
Right.
That when they feel better, they feel like they look better, they want to take care of themselves better, and I think that all kind of feeds into where we end up with our patients. So that's kind of cool.
That's a huge part. And again, in patient selection, there's a lot of counseling involved. So there are people who are just not fit to have local liposuction. And they really need to lose some weight first, or some people, have muscular defects that need to be where they need a full traditional tummy tuck, where they need that muscle brought back together before anything can be done. Many times we find hernias. People didn't even know they had a hernia in their navel, and I'll find that and send them out and tell them you have to get that fixed first.
Right, that makes sense. All right, well, we have a call. Are you ready?
Ready.
From Tracy in Florida. Hi, Tracy.
Hi.
How are you? Thanks for your call. How's weather in Florida? Probably cooler than New York today. We're at like 95 here.
Oh, wow. It's actually, you can feel fall around the corner, which is rare for Florida. So you actually can feel fall. I'm watching wind happen in the palm trees.
I know, and the thing is, you look forward to it, and we cringe because we know winter's on the other side of it. But you just get more awesome weather.
Exactly.
So tell us about you. How are you doing?
Good. Well, I wanted to share with you guys and really your listeners, because I wish I could just sing it from rooftops. I waited. I've had Botox, and it was really great. And after I did it, my cousin did it, and everybody got on the bandwagon. And I loved it, and it's been wonderful. But for years and years and years and years, I have put off doing permanent eyeliner, and I have every single eyeliner from the Chanel to the best reviewed one on the websites, and anything I use would always smear and create kind of like a dark circle under my eye, no matter what I used, if I set it with powder, if I set it with shadow. And for years and years and years, I put it off. And I just got my permanent eyeliner done, and I cannot tell you what the difference it has made in my confidence, and just it hurt about half as bad as I thought it was going to. And the recovery was half as bad as I thought it was. It was really nothing. And if anybody's thinking about it, I just wanted to share with everyone, it really has boosted my confidence so much.
That is such a great story. I love, and thank you so much, Tracy, for calling and sharing with us, because I did it too. And have you done it, Tracy?
No.
So you're not Tracy. I've done it too. And you haven't done it, Tammy?
No.
I did it when I turned 40, and then I just touched it up a few, like 7 years later. And it stayed since then. But I didn't ask for liner. I asked for definition, so it's super thin. And then she did something called the lash enhancement. Tracy, did you get that too, the lash enhancement, where they kind of go between lashes? They put little dots between the lashes, which makes you look like you have more lashes. And I agree with you. I never feel naked. I sometimes forget to put on makeup or even mascara because my face feels done. And now I still add liner to it sometimes, just add a little bit, so maybe I'll go get a little bit more. But it's nice because you can dress it up if you want and add more to it or a color. And if you don't want, you just go out. But I also agree with you. I tell people it's one of the best things I've ever done. So thank you for telling us.
Yeah, and I found that I was wiping my eyes underneath all the time, and I thought, well, that can't be good for my skin underneath my eyes.
It's not good. But there's a trick to that I learned from a makeup artist, because when I wear mascara or a liner on my lower eyelid, it always runs, especially on my left. And then by the end of the day, because I wear so many goggles for lasers, people think, oh, you're so tired. But meanwhile, it's my liner running. So if you put a little bit of setting powder or even just light eyeshadow right underneath with a little brush, then that powder will hold that liner in place and it just absolutely won't run. I mean, it's a miracle what that can do. So I'm glad I didn't know that before I got the liner, because I may not have gotten it, the permanent liner, but I'm so happy I did it. So Tracy, if you end up adding makeup on top of what you have, try that little powder underneath, either a setting powder or just a lighter colored eyeshadow. Like, in the palette, there's usually like a white that you might use for a highlighter. Try that underneath. Mm-hmm. And do you have patients, Tammy, who get the permanent liner? Do you like it, not like it?
I do. I think it needs to be done properly, and they need to use the right color. Because you see a lot of fading of black to blue or purplish, and it's not so pretty, especially for eyebrows.
It's worse on the brows, but if it happens on the liner, it sort of blends in.
Right.
There's someone I've had on the show from her Instagram is Beauty and Brow Lounge, and her name is Rose. She's amazing. So I don't know if you're near her in Florida. It sounds like you went to a great person and they did an awesome job, but Rose is amazing at Beauty and Brow Lounge in Florida. I think she's in Miami or in that area. So I always like to give her a shout out. And she often listens to the show and comments. So I hope she's listening and maybe calls in later and tells us some of her techniques, because she's brilliant at it. And her Instagram is very cool. So Tracy, thank you for sharing your story with us. I really appreciate it. And it is a confidence booster. So, I tell people often that if they don't have a lot to spend on aesthetics, if they just get a lash enhancement,
absolutely,
and have that liner, like the eyes popping, makes everyone look good in a strong brow. Mm-hmm. Thank you, Tracy. So tell us a little bit about, because as we get to the end of the show, about the power of confidence as people age, because I think that as the population gets older, people start to feel invisible, and they start to hunch and pucker and furrow and sort of implode on themselves. And a lot of what I do is talk about facial exercises to help people sort of be more present and feel better. So how do you approach that as people age to still feel beautiful and confident?
Well, I think, as we age, we lose the fat in our face, we lose that volume, and that really, just restoring that even a little bit. You can't, if someone waits until they're much, much older, that's a lot to put back in. But sometimes you can really get them kind of close where they're really happy. And again, everything sags, goes down towards the chin and the jawline. You get the little droops we don't like. But if we can kind of restore that reflection back up towards the eyes, that's super helpful. So restoring some of the volume in the cheeks is very helpful. Putting more volume back towards the ears and the jawline, that's kind of almost like a pre-facelift type maneuver we can do with fat transfer. It's wonderful. And they handle it very, very well. Just things like that to really restore some of that. And also, seniors are still concerned about their whole life. They feel more quieted. But I do have this great story of this older lady who was much older and said, I just can't deal with this tummy pooch. And the boys were teasing me in second grade. And so we did the liposuction, and we saw her at a week out, and she was in tears, just said, I never have to worry about that again. I carried this burden my whole life, and we were so happy for her.
Yeah, it's true. I never look at somebody's age. I think, I love that people at any age, and the older I get, the older gets, so I'm not putting a number on it, but I find that if somebody comes in and they care about how they look, that's a sign of being vitally alive and wanting to be present in the world. So right. I don't begrudge anybody wanting to look good. When someone says, oh, for my age, or I'm too old to do things, I'm like, no, you're here. You're not too old.
And the older that we grow, people are more and more active and really healther than we used to be.
Yep. Yeah. Well, thank you so much. I'll give out your social media one more time.
www.medbutopia.com.
Great. Thank you. And we have to take a break, but thanks for joining us.
Thank you so much for having
Dr.
me.
Tammy Polit. And everyone follow her on social media, and just go see how beautiful, and she walks the walk, and she also talks the talk. So I love that. And we'll be right back after the break.